You are listening to The Scope, a podcast dedicated to having open conversations about healthcare topics relevant to our patients and community. Today we're talking about sleep health and sleep apnea. Let's get started. Today our guest is Hala Samman, MD, who is our sleep medicine specialist at Phelps Health. Thank you so much for coming to our show today.
Yeah, absolutely.
We are very excited to have you here. I don't think we've ever had a sleep medicine specialist on our show, so this is bound to be really interesting, right?
Wow. Yeah, absolutely.
So before we kind of dive into sleep medicine and what all that entails, tell us a little bit about yourself, Dr. Samman.
Sure, yeah. So I'm originally from Ohio. That's where I grew up, and I completed my neurology residency at Kansas University Medical Center, and then I went on to do sleep medicine fellowship up in Rochester, Minnesota at Mayo Clinic. But yeah, that's just a little bit about me.
Yeah, very cool. So what interested you so much about sleep medicine? What kind of drew you into that field?
Sleep in and of itself just controls so much of your health, and it's so important. And so being able to prevent disease or prevent something from getting worse was really important to me. So that was a big draw.
Yeah, I'm a huge fan of sleep. I'm a person who needs a solid 8 hours in order to be a functioning adult.
I can understand that.
So let's just dive right in. How important is sleep?
So I think it's as important as breathing and eating. It's one of the main, really important things for your overall health and well-being. You know, a lot of studies have linked poor sleep in kids with poor attention span, poor learning and memory, bad behavior, and also, you know, just for overall mental and physical health. You know, kids really need sleep. And also for adults as well, not getting the recommended amount of sleep per night is linked with things like diabetes, stroke, heart disease, heart failure, funny heart rhythms, high blood pressure, and just overall as well, your memory gets affected and just health. And so it's really important. Obesity too, I forgot to mention, just increasing weight gain and obesity is linked to not getting enough sleep at night.
Let's talk about how many hours of sleep, should children, teens, and adults get each night. So I mentioned to you, I'm a big fan of 8 hours of sleep, but is that average, and what does it look like for different age ranges?
Absolutely. So on average, adults ages 18 and over should be getting at least 7 to 8 hours per night. You know, some people are a little bit longer sleepers and need a little more than 8 hours, and that's absolutely fine. As long as you're not getting less than 6 and more than 10, I think is a good number. And again, each person's different. So while some need 7, some need 8, others need 9 or more. So
what is bad about getting more than 10 hours of sleep?
So getting more sleep can also be, too much sleep can be linked with things like diabetes and increased stroke risk, increased heart disease as well.
Now, what about sleep apnea? So, some people go to sleep at night and they can't ever fall asleep, or, whatever the issue is, and it wakes them up.
So sleep apnea is a condition where your airway may collapse on itself or your tongue might fall back. And what's happening is your oxygen's briefly dipping multiple times per night. So you're not getting the oxygen level that you need to your brain, but you're also waking up multiple times a night. And so you wake up feeling unrested, you're tired and sleepy during the day, it affects your mood, your memory. And so it's really this condition that you're not often aware that it's happening because you often feel like you're asleep even though you're waking up often, but other people can tell you if it's occurring.
Is sleep apnea something that's hereditary, or does it happen because of lifestyle choices?
It's a good question. So it can be hereditary. So people who have inherited a narrow oral airway, so the back of the throat, depending on how wide or narrow it is, can place you at a little bit higher risk for sleep apnea. And also just the anatomy of the jaw, smaller chin, or teeth that are set back a little bit can be something that's inherited from family.
Wow, I had no idea. So what about like sleep apnea? Let's say somebody that does have this, they may not know. How does it affect their daily life? What are some ways that they might recognize, hey, maybe I should get this checked out?
So a big one is sleepiness. If you're sleepy during the day, you're tired, you can't get through your day. Attention and memory too. If you feel like, you're struggling, you're in this kind of memory fog, you can't think clearly, you're having trouble computing or just, paying attention to things, or your memory struggling and just, tired through the day. That's one big thing to look at.
Are there risk factors for different ages, for men versus women, whenever it comes to sleep apnea? Are more people at risk versus others?
So men are slightly higher risk than females for developing sleep apnea.
Is there a reason for that?
I think it tends to be with neck circumference and how wide the neck is, and maybe airway anatomy, and the more likelihood to have obstruction in the throat.
So for women, that kind of makes me laugh, because I'm like, oh, I guess I'm really glad that I'm a woman, because I probably would be less likely to have that issue, right?
It's not It's not a significant, so it's not a significant reduction in risk. So the bigger risks that I look at are things like the airway anatomy. So that's one of the big ones. If you have a narrow oral airway in the back that I look at during my examination, that puts you at a high risk. The second one is neck circumference. Absolutely. For men, it's anything over 17 inches, and for female, anything over 16 inches places you at high risk. Now, there are men with neck with less than 17 inches and females with neck with less than 16 inches that absolutely have sleep apnea. So that's not an absolute necessary factor. But the wider the neck gets, it's associated with weight gain. So that places you at higher risk as well. But also time. So as you're nearing 50s and above, the muscles in the airway are more likely to relax and collapse at night. So that's another big risk factor.
Is there a way that as we age, we can strengthen those muscles in our airway, or is that just part of aging?
It's something that I think is part of aging. I know there are some neck strengthening muscle exercises that are out there and available, but I don't know that they've really been studied or known to do significant, improvement.
Yeah, there probably needs to be more research done and correlated, right?
Absolutely.
So why is sleep apnea often so underdiagnosed?
Good question. So most often people don't know that they snore,
Yeah,
or
they
don't
they're
know
just
that,
sleepy, right?
Absolutely, or they don't know that they're stopping breathing, or I think in popular media, snoring was just thought to be part of you're getting good deep sleep, and so you're snoring, and so often people don't know. And sleep apnea was one of these diagnoses that we just recently started learning more about. So back in the late 80s to early 90s is when we started to really discover it and learn more about it. And just now we're still, starting to understand how much it can really interfere and affect your health overall. So I think more and more we're learning more about it, and people are starting to identify it and learn more about it. But you're absolutely right. Often it's just underdiagnosed and missed.
Yeah. So you talked about snoring, which I think is so interesting, because you said sometimes people will just say, oh, I was so tired, I slept so good, that's why I snored. I've done that. I've actually said that too in my own personal life. Okay. So is snoring always a sign that you may have sleep apnea, or what is snoring?
That's a very good question. So a majority of times, the people that I see in my clinic, a majority of times snoring is linked with sleep apnea. But there is a small possibility that you can have primary snoring, which can be related to just congestion or enlarged nasal passages that are causing resistance to the airflow. So it's not 100% always linked to sleep apnea, but if you do have snoring, it puts you at higher risk to have underlying sleep apnea.
Yeah, really interesting. My husband too, whenever we drive places, he will lay back, and whenever he lays on his back, sometimes he snores. So now I'm like, boy, we probably need an appointment.
Yeah, definitely get it looked into.
While we're here, let's diagnose.
Absolutely.
So, if a loved one is a chronic loud snorer like my husband, could there be a chance that they have sleep apnea?
Absolutely. So things to look at are, chronic loud snoring. There is a screening questionnaire available that you can go through that you can identify and see if someone is at higher risk for sleep apnea. So scoring 3 or more on this questionnaire places you at higher risk. Now, just because, let's say you score 2, I think it's still important to get evaluated if you have some symptoms. It doesn't absolutely mean that you don't have sleep apnea, but it's called the Stop Bang questionnaire. So S stands for do you snore? So that's 1 if someone's snoring. T is do you feel tired or fatigued during the day? O is obstruction. So has someone told you that you stop breathing, or do you wake up gasping for air? And then P is do you have high blood pressure, or are you treated for high blood pressure? So, and then B is BMI. So do you have, elevated BMI? Usually over 28 is what we look for. And then age, that's one of the ones I was telling you about, is as you near age 50 or above, that's one of the risk factors. And N is for neck circumference, so that's what we talked about for males, neck that's wider than 17 inches, and for females 16 inches or above. And then G is gender, and that's are you male? So males again slightly.
Yeah, unfortunately for males.
Yep. So again, 3 and above. Definitely get evaluated. That puts you at higher risk.
Yeah, I'm like laughing as I go through this because I'm like, oh, I guess I'm, today going to be making an appointment for my husband.
That's right. And one other thing, so I don't want just the screening tool to be the reason, but so if you scored less than 3, there are a lot of people who have high blood pressure and atrial fibrillation. So about 80% of people who were found to have high blood pressure plus a funny heart rhythm called atrial fibrillation that have sleep apnea, whether it be diagnosed or underdiagnosed. And oftentimes people with heart disease are underdiagnosed because they don't have the classic symptoms that we associate with sleep apnea.
Yeah, absolutely. So how difficult is it? We talk about how difficult it is to diagnose sleep apnea, and you guys do these things called sleep studies. Let's talk about that. What does a sleep study look like?
So a sleep study, so there are two different types of sleep studies. There's an in-lab sleep study where you come to the sleep lab, and basically the sleep lab kind of looks like a hotel room with a bed, TV, nightstand, and whatnot. Or there's a home sleep apnea test where you can get hooked up and then sleep at home. Between the two, the in-lab sleep studies are more accurate, and they can tell me a lot more. They can tell me more about if someone's leg kicking at night is causing awakenings, or if there are other problems with sleep that we need to look at. But a home sleep apnea test is a good start. Home sleep apnea tests can sometimes underestimate the severity and or the presence of sleep apnea. And so for some people, the recommendation is to go forward with an in-lab study. But for those that are hesitant to sleep outside of their home, it could be a good starting point. With the in-lab sleep study, what happens is people are hooked up, so there are wires. It's not usually indicative of a typical night's sleep, but often we can get good information to really let us know if someone has sleep apnea or not. But it's, again, looks like a hotel room. There's technicians at night that score the sleep study, and then, I read the sleep studies in the morning, and then we review the results after that.
Yeah, it's interesting listening to you say that, because my first thought would be that an in-lab sleep study may be skewed because you're outside of your normal environment. So why is an in-lab sleep study so much more valuable than at home?
Home sleep apnea test that we use at Phelps Health doesn't score sleep. So I don't know if you're awake or asleep. So if you're having apneic episodes, it can divide those apneic episodes over awake time. So it can underestimate.
Okay.
And then, I'd say about 30% of the time, 20 to 30% of the time, it can say that you don't have sleep apnea when you actually do. It doesn't look at things like leg kicking or periodic limb movement disorder. And then, with an actual sleep study, I can look at different sleep stages. I can look if you're in deep sleep or dream sleep. I can see, okay, does your sleep apnea worsen when you're on your back? Does it worsen when you're in dream sleep? What type of sleep apnea do you have really? And even, various little details that I can look at in an in-lab sleep study tends to make it a lot more accurate.
So you talked about dream sleep versus deep sleep. I thought they were the same thing. So let's talk about that.
Yeah, the sleep stages. So there are 4 different sleep stages. There's light or in between sleep. It's called N1 or light stage sleep. That's that sleep that we just briefly get. We transition between awake to light stage sleep. So if you take a nap and you fall asleep in this stage of sleep, you're often not really sure if you slept or not, or if you hear your name being called, you wake up. So that's our transitioning point. And then there's moderate stage sleep. So that's N2, and that's where we spend most of our night generally. N3 is our deep sleep. So that's really important sleep that we need, that people with sleep apnea don't get enough of, or if we're sleep deprived, we don't get enough of. And interestingly, just recently in 2016, there was a new study that came out that realized that the brain actually has a toxin clearing system. So we never knew this, and that toxin clearing system only comes out during deep sleep. So if you're deprived from whatever reason, be it sleep deprivation, not getting enough hours of sleep, or sleep apnea, so your brain can't clear out those toxins, and then you have those same misfolded protein that you find in Alzheimer's dementia. And so we don't necessarily know the full link. Is there a link between sleep deprivation and sleep apnea with Alzheimer's dementia? But there are currently studies going on now to find out if there truly is a link.
Is sleep medicine a very old field?
No, it's new. It just came about. I think in the 90s is when there were starting, late 80s, early 90s, when they started to do sleep studies and really identifying.
Yeah, it's amazing hearing all these different phases of sleep and hearing how much it's progressed since the 90s.
Right.
It really blows my mind. Like, we have so much more to learn about sleep and how important it is and how valuable it is to our overall well-being and health, right?
Absolutely.
Yeah, very cool. I think a lot of people don't realize that.
Absolutely. And I forgot one more stage of sleep. So
yeah.
So then there's the dream sleep. So that's the sleep where often I see sleep apnea getting worse, because when we go into dream sleep, our brain sends out this hormone to paralyze our muscles so we don't act out our dreams. And so the airway becomes a lot more collapsible. And so what happens is sleep apnea can become a lot more severe, but then people aren't getting as much deeper dream sleep, though they might feel like they're having more nightmares or more dream sleep because they're waking up more often because of apnea episodes during dream sleep.
So are nightmares related to sleep apnea?
They absolutely can be. So if you're stopping breathing, your dreams can turn into nightmares because you feel like you're gasping or you can't breathe, and you're waking up more frequently from your dreams and or nightmares.
Yeah, so for any of our listeners, if they are experiencing this type of thing, it's definitely something to know and to take stock of.
Absolutely.
So what can a patient do to help prepare for an appointment if they think that they may have sleep apnea? Let's say that they've scheduled an appointment with you. Do they need to start documenting their night's sleep before they come visit?
That's a good question. I think what's really important and often people aren't really sure of is if they stop breathing or if they snore. And it's something that, again, we won't know if we do, but a bed partner or a family member, whether you've shared, a bed on vacation or hotel room, can tell you if you've stopped breathing at night or if you snore, because that can be very valuable information.
Yeah, absolutely. And if you don't have that person, we have videos on our camera.
Absolutely.
I mean, nobody wants to go through 8 hours of sleep video, but if it's something that you're really struggling with, that's definitely an option.
It's a great idea.
So one of the things that we talk about whenever we talk about sleep medicine is there is a scale called the Epworth Sleepiness Scale. What value does that bring?
So that tells me if someone's, what degree of sleepiness, if the sleepiness is something that I have to intervene with. So if someone's very sleepy during the day, it can be from sleep apnea, but it can be from other disorders like narcolepsy or something called idiopathic hypersomnia, which is just a disorder where someone might have irresistible periods of sleepiness. It's a great monitoring tool that I have with people who have sleep apnea to see, does their sleepiness improve with treatment of their sleep apnea? And if not, what other interventions can I do, or where can we go from here? Or are they on the right treatment?
Is sleep apnea very commonly misdiagnosed with other sleep disorders?
So I think it can be misdiagnosed with people who are having fatigue with other disorders, but oftentimes when sleep apnea is identified, it's usually the sleep study can give you a very definitive diagnosis. There is, that's actually a good question, because there are some people who have sleep apnea, get started on CPAP and feel like they can't tolerate it or it doesn't work well for them. There is a different type of sleep apnea that may come about with the start of CPAP that can worsen or cause a different type of sleep apnea. And so the people who have struggled with CPAP in the past, I don't want them to feel like this is it. There's other alternatives or things out there that can really benefit them or treat their underlying sleep apnea.
What are the different types of sleep apnea?
So there's obstructive sleep apnea, which we talked about, the most common, where the airway collapses. There's another type of sleep apnea called central sleep apnea, and that's basically where the brain just for some reason forgets to tell the body to breathe. And so for a majority, it's something called idiopathic, where the medical world doesn't really understand why you might have central sleep apnea. For some, we can identify something in the brain, a lesion in the brain area of the brain called the brainstem. And so with anyone who's diagnosed with primary central sleep apnea, we do an evaluation with an MRI of the brain to make sure they don't have something in the brainstem. We also look at the heart to make sure there is no evidence of heart failure, because that can be a reason why someone may develop central sleep apnea. But also it can be due to sometimes opioid medications can cause central sleep apnea as well. Again, it's not as common, but it's definitely something to keep an eye out for. And traditionally, people who have central sleep apnea, the traditional BiPAP doesn't usually work well for them.
For the people who may have the central sleep apnea and maybe they have something on their brainstem, is that something that can be removed? That's
a good question. It all depends on what it is. So there are things that people can be born with that are what we call congenital, just something that they're born with. There are other things that could be, a mass or a tumor or something that might need to be, followed routinely with imaging. Sometimes it could be vessel abnormalities. So it all depends on what's found, that kind of directs where we go.
Yeah, it's really interesting to hear this, because to me, I'm like, this is why it's so important to establish primary care, to go to your physician on a consistent basis, to go and get evaluated if you're having problems with your sleep, so that you can address these before it becomes a long-term issue.
Absolutely, yeah.
So what happens if somebody doesn't address, the effects of sleep apnea and they have it and it goes untreated?
Oh, I love this question. So sleep apnea when chronic and untreated. So I like to equate sleep apnea to something like not brushing your teeth. So if you don't brush your teeth for a day or two or a month, maybe you can get away with it. But any longer, you start to develop cavities. And same with sleep apnea. If you leave it untreated over time, you're at much higher risk for things like high blood pressure, resistant high blood pressure. That's blood pressure that needs more than one medication to be well treated. Your heart's working so hard to keep up with oxygen demand that it starts to dilate and you go into something called heart failure. And as the heart starts to dilate, your heart can be thrown into funny heart rhythms. The main one we worry about is something called atrial fibrillation. The reason being is because that can cause stroke to the brain for people. And so we worry about someone developing atrial fibrillation. And then additionally, you're not getting good deep restful sleep. So your memory is affected, which we talked about. If you have any underlying depression or anxiety, it's so much harder to keep them at bay or balanced because you're in this chronic sleep deprived state. You're tired, you're irritable, and also pain. So a lot of people struggle with pain, and it's not that sleep apnea causes pain, but your nervous system is on this hyperarousal, hyper alert mode where the nerve receptors are just firing and firing, and it's so much harder to keep your pain at bay. Same with increased risk for metabolic resistance, which has higher risk to develop diabetes down the line. eye pressure problems that can lead to vision loss in the future. What else?
What about headaches or migraines?
Absolutely. Daily morning headaches is one of the things we look at for sleep apnea, and that's one. And if you have underlying migraines, it can make migraines worse because your oxygen's dipping quite frequently at night. For a lot of people, also loss of libido and erectile dysfunction can be one. And if you are someone who needs pain medications or you need prescription medications to help you with falling asleep at night, those medications can cause your breathing to be more shallow, and it places you at a slightly higher risk of death. So it's so important to identify if you have sleep apnea and get it treated so that, it puts your risk, it minimizes your risk significantly.
Yeah, that's a huge laundry list of things that could potentially go wrong or lessen your lifespan or, cause the quality of your life to become diminished.
Right.
So if that doesn't convince somebody, I don't know what will, right?
Right.
So what options are available for people who have sleep apnea and they know and they're aware and they want to do something to make it better?
So the first, second, and third treatment that we always look at is something called PAP therapy or CPAP, BiPAP, whatever is determined that they need. The reason being is because we consider it the gold standard of treatment because we know it works when it does work. It has very minimal side effects, and often, there are some struggles people may have with finding the right mask, which is very normal, or getting the humidity adjusted. And when we can work through those struggles, PAP therapy can be really excellent treatment for a lot of people. If PAP therapy doesn't work, then there are some other different treatment options. For people with mild to low moderate sleep apnea, there's a dental oral appliance called the mandibular advancement device that can be fitted through a dentist. It's something that medical insurance does generally tend to cover, and basically it's an oral device that they put at night that just moves the jaw forward. There's also surgery, so there are 3 types of surgeries that can be done, and these are usually recommended for more moderate to severe sleep apnea. Again, it's usually if we've tried and failed CPAP, BiPAP, or whatever PAP therapy first, second, and third, and then we discuss surgical treatment options. So there's one surgery which is the traditional surgery that's known, where they go in and they just remove part of your airway. It's called UPPP. That's about 40 to 60% effective, and it can have some recovery time you can have some sore throat and whatnot. There are some newer options with sleep-trained ear, nose, and throat doctors where there's a little bit higher effective rate with various different things other than just cutting out the airway, but maybe lifting some of the palate. There's another type of surgery called mandibular maxillary advancement surgery, and basically what the surgeon does is they put a little crack in your jaw, upper and lower, and they move it forward with hardware, and then the bone grows together. It's a very invasive surgery. Yes. Surprisingly, I've been told it's less painful than the soft tissue surgery because bone pain can be controlled with pain medicines well. And it's actually a little bit higher success rate. It's about 80% successful. So that's a possible option. But then just recently, I'd say a few years ago, there was a new device that came out called Inspire. And it's a lot like a pacemaker where there's a battery pack that's inserted under your chest with a little wire that goes up to the nerve called the hypoglossal nerve. So this nerve is meant to just stimulate the tongue movement. And what you do is you turn it on at night and it senses when you're breathing in. And when you do, it gently pushes the base of your tongue forward. So often people tell me that they feel it initially, but then over time, they feel like they can't tell if it's on or off. So that could be a possible good treatment for people who just really can't tolerate.
So is that surgical as well? Like it's under your chest?
Yeah, it's considered surgical because they have to insert a battery pack with the wire inserted upwards.
Wow, that is really cool. That's amazing. I love the name of it too, Inspire.
Inspire, absolutely.
Yeah, I got the Inspire surgery. No big deal. So one more quick question before we wrap up. How can we create better sleep cycles and schedules in our busy lives?
That's a really good question. I think just, understanding how important sleep health is for your overall health and well-being, and just really trying to give that to yourself and scheduling that time and saying, well, if I have to wake up at this time, I need to be in bed by this time, and just giving that to yourself is really important. Setting a consistent sleep-wake cycle is really important too through the week and weekends, so that you're not playing catch-up sleep on the weekdays or the weekends.
Yes.
But yeah, great question. I don't think we have a great answer because our lives are so busy, and I think just putting more emphasis on your health and well-being is really important.
Yeah, great advice, Dr. Samman. Thank you so much for being here today. I learned so much from you, and I hope that our listeners do as well.
Thank you.
So thanks so much for tuning into The Scope. If you liked this show and would like to know more, check out phelpshealth.org.